way to make sure that you hit the bullseye is to present it, if you will, at an angle, right, and then just bring the needle up, as opposed to trying to hit it right in the middle. Sometimes what ends up happening is you end up puncturing the bag, and then you have to waste the bag. We'll pull up 2 cc's of the vitamin C. And usually what I do, I'm doing this now in real time, but if I know that Dr. Myron is gonna do the procedure, I'll get this ready before I even walk into the room. And so it'll already be on the IV pole, the tubing will be primed, and it's just a matter of going in there, having that in the background, then getting the PRF, and I'll show you how you get your blood from the IV catheter. And then last but not least, we'll pull up the 2 cc's of biotin. And this is your beauty component, if you will.
I can do B12.
Say it again, B12 is usually IM, and also patients are sensitive to B12. Sometimes you tend to feel somewhat like if you had a shot that just gave you a lot of energy, and so normally B12 is given separately. Yeah, in our compound pharmacy, B12 is not included in the B complex. How often?
Yeah.
We have patients that do this monthly. I mean, again, these are just over-the-counter vitamins and minerals that you would normally take PO, but now you're getting it intravenously. And again, the amounts that I'm giving, 1,500 milligrams of vitamin C, it's not really a high amount of vitamins and minerals. It's enough for them to just feel that it's doing something, right? It's going directly into the bloodstream, and you just want the patient to feel well. And what I've noticed is after the infusion, they tend to feel better, and then they keep coming back. All right, so that's all done. Now what I'll do is I'll prime my tubing. So before you go ahead and spike the bag, always take the roller clamp and roll it all the way down. The reason being is that the moment you spike, you're going to get all that solution rushing down the tubing, and then you're going to get a lot of air, right? And you don't want air in the line, so you just gently squeeze the chamber. The drip chamber, I usually do it just a little bit below halfway. And then what I do is I'll take some gauze, and I'll hold the distal end of the tubing and wrap it around. So that way, as I'm priming the tubing, when it gets to the very end, you're not dripping on the floor. It's just going into the gauze, and you'll feel the gauze start to feel saturated in your hand, and that way you know that the tubing is completely primed. And again, just baby the roller clamp. You don't want to open it up all the way because again, it's going to drip very fast, and you're going to get air bubbles in the line that eventually you're going to have to prime out of the tubing. So the slower you go, the less bubbles you'll have. And that is fully primed. All right. So now, I'll bring the IV pole over to the side that I'm going to be working on. And I find the pillow is very comfortable to have the patient's arm on the pillow as opposed, sometimes, you know, they say put a fist, but if you have, these are cheap pillows that you can buy on Amazon, disposable pillowcases, and it really does make a difference. It makes it more comfortable. You don't even have to do that. Yeah, you can just rest it right on the pillow. So now what I'm going to do is I'm going to get my IV set up, right? So one thing that I can tell you is if you're going to start an IV and you're going to draw blood from it, you want to use a 22 gauge catheter. Usually if it's just an infusion, you could use a 24, but a 22 is ideal because again, you're not going to get hemolysis, right? I mean, it's an ample size catheter that you're going to get good blood flow, and it's going to give you the best yield of PRF. When I've done it with 24, I noticed that there's a lot of rupture of red blood cells in the top layer of the plasma. And that's a no-no for facial, right? Because again, you're gonna get hyperpigmentation. So I'll open up all my equipment, get my 22 gauge catheter. This is a 10 cc syringe that's pre-filled with normal saline. You could also buy 10 cc syringes, attach an 18 gauge needle to it, and just pull from a bag of normal saline and make your flush. And this is your extension set, right? So this is what's going to connect to the syringe. And you're going to prime it as well. So the extension set is ready to go. This little device right here, this safety holder, this is what we use for the blood collection from the IV catheter. So once I have the catheter established, I'll connect this, and then I'll be able to pop the tubes of blood right from here. At that point, one stick, you're able to get your blood for PRF, and then right after that, you're able to just connect the IV and have it drip away. All right, so now comes the good part. All right. So as I said, I use the blood pressure cuff as a tourniquet. I've been doing this for a long time, and I find that it's more comfortable for the patients, and also patients that have really, really small vessels. It's going to help you. And again, you don't have to inflate it very much. I mean, to 100 is just enough. Do that for me. There it is. So as you can see, it's starting to get much bigger than what it originally was. And the nice thing is also that she's fair skinned, so you could actually see where the vessel is. Get all your equipment ready. Here we go. All right. What you want to do is you want to approach this probably at about a 30-degree angle, right? So what you're going to do is you're going to insert, you get the flash, right? You drop your catheter, and I'm going to show you now. You see you're getting the flow of blood. You advance the catheter, you put pressure. These are good because you just hit that button and it retracts the needle. You deflate the cuff, you come here, you attach your hub for the blood, and now that's it. Now you can get blood. No blood is going to come out, obviously, until I start popping the tubes, and the vacuum will pull the blood for us. Excellent, good flow. How you doing? Work? Good. Any tubes? 6. On the last two, you can go ahead and inflate the blood pressure cuff. So now I have my extension set. It's primed, ready to go. I mean, at this point, if you wanted to, you could connect the tubing, but I just get into the habit of connecting the extension set to the catheter itself. So with one finger, you'll hold pressure, with the other, you'll unscrew, connect your extension. It's already primed with saline. You flush, you pull back, good blood return. You could also advance the catheter, you could float it in. Now, your IV is established. You put this nice 3M Tegaderm that we use. Away. Flush again, make sure that they feel no pain, right? If they feel pain, then more than likely you're not in, right? Also, you're able to pull back, get blood return, you're able to visualize that you're in the vein. Clamp it. And then 2 pieces of transport tape, you'll give it a J-loop. Again, just to reduce the risk of them pulling the IV out of their arm. And I put most of the tape on the Tegaderm. Sometimes people are very sensitive to the adhesive, so I find most of it can just go on the Tegaderm with very little actually on the skin. All right, so there's your IV, it's been established. Come now, your bag is all ready to go, the tubing has been primed. And these we usually give in the office over 30 minutes, so this is a 500 cc bag. Your drip rate is going to be about 3 drops per second, right? So that's about 167 drops per minute. And if you don't have a pump, I mean, you would just do it, you know, by sight. Let gravity do what it does. That's it. Dripping away. At this point, she's got her IV, and then it doesn't get in the way of the procedure that she's going to be having done. And it's an additional treatment that could be provided for the patient while they're getting their biocare.
Yeah.